Danielle. And now we go to Christine Petit from Building Healthy Communities in Long Beach. Go, Kristen.
Hi. The picture that you see was taken about 10 years ago in the early days, the planning phase of the California Endowment's Building Healthy Communities initiative in Long Beach. In the front, you see the focus is on 3 people sitting at a table reviewing a draft of the governance document for BHCLB, surrounded by others who are doing the same thing. Over the past 10 years, there have been some amazing photos taken to showcase our work. Large group photos at summertime community events, smaller groups posing victorious after a long night at City Council, vibrant pictures at protests and actions, the list goes on. So why did I pick this one? The 3 people you see centered in this photo are a representative from the mayor's office at the time, Eva, a community resident and leader, and Dr. Nicholas, an organizational leader. Long Beach Forward is the organization that grew out of the Building Healthy Communities initiative in Long Beach, and the organization that I recently transitioned out of the role of executive director for. There are still amazing leaders there, but Long Beach Forward is described as the glue that brings people, community organizations, and decision makers, the types of people that are highlighted in this picture, together by providing the tools and resources they need for positive change. We support community leaders and help advance equitable policies. And we do this because we believe that everyone in Long Beach should be able to influence decisions that impact their lives. And we know that oftentimes low-income communities of color are left out of decision making. So these are the values that Building Healthy Communities Long Beach were born out of, that everyone in Long Beach should be able to influence the decisions that impact their lives, and that the ability to do so is a matter of life and death. You see, there is a 7-year life expectancy difference depending on the zip code you live in Long Beach, and it's actually up to 17 years when you look at it at the census tract level. With those living in wider, wealthier zip codes and from those demographics living longer than people in zip codes that are comprised of low-income people of color. So I always say this is a matter of life and death. The work to ensure that residents who are typically left out of decision-making can be heard in our struggles for environmental justice, economic inclusion, equity and education, and they were often not and are still not always understood or welcomed in City Hall or at the school district where we advocate. And yet we've been able to change over 40 policies and practices through the BHC initiative and other partnered initiatives that we work on. So changing the narrative of to inclusion instead of exclusion, highlighting systemic inequities, and uplifting the experiences of people most impacted by the issues that we work on has been one of the most critical components to change the conditions that we've achieved while working in coalition with over 50 organizational partners around tables, much like the ones that you see in this picture. Thank you.
Wow. Thank you, Christine. And I was sort of compelled to look over Eva's shoulder while she was looking down at her document, and as were the others in the foreground. Behind her shoulder, there was much animated conversation going on. And I think what that points to is holding space to bring different groups, different voices to the floor, and also creating moments of pause and reflection as one creates moments of conversation and dynamism. Thank you so much.